that we are all gathered on Aboriginal land across this vast place now known as New South Wales. I am broadcasting to you from Bidjigal land and take this opportunity to acknowledge elders past, present and emerging, and to acknowledge any First Nations peoples on this call this morning. Thanks for joining us for this roadmap update discussion. So just a bit of housekeeping, we're recording the webinar because we're very limited in the numbers and the current plan that we're on with this meeting. And so we are making the recording available. So please do let your people know that this will be available very shortly on our website. Please keep your microphones on mute as this will cause interference in the information. And also please use the chat box to ask any questions as we go through this webinar. There's a lot of information that we're going through today, and hopefully we'll get through all of your questions. Some of the questions that have been answered in advance of this webinar we'll get through the course of the webinar. So if you've asked us a question which has been answered in the webinar, we won't be necessarily repeating it, but if you do want clarification, obviously please ask in the chat. Ashley and I are the people at Create New South Wales that are working on communicating all of this public health information and all of the processes that are involved in various aspects of that to all layers of this sector. And we do recognise that people are very challenged at the moment, and it's been a very difficult time through, you know, we're in week 14 of lockdown and it's been very distressing for everyone. We do understand that, but we do ask that you keep your engagements with us as civil as possible. We recognise that you're going through a hard time, but we aren't the people that are making decisions. We're trying to help you with the decisions that have been made and to clarify those issues for you. But please do connect in the chat. We will answer your calls. We will answer every email that we get from you. Sometimes we don't have the answers, but we want to assure you that we are trying our best in this regard. Okay. So let's move forward, Ash. So this is basically we're going through everything that we currently know about the roadmap to reopening. We're going to answer all of your questions, and I'm going to take you through all of the advice that we've been given that should help you with reopening. So we're going to go through, firstly, the top questions that we're getting asked. We're going to go through those now. So the main question we're being asked is the QR code application going to be ready with the vaccination check in place by the 11th of October? And we're assured that it will be. And that's the best of our knowledge at the moment. So the other question that we're getting asked is when will the public health order be available for this date? And public health orders are emergency pieces of legislation. They're signed the night before they come into effect. So we don't get to see this material before it's published. So we have been advised very strongly to use the current PHO and part 2 in that PHO as a guide to what will be allowed across the state. And this is the guide that is in current operation in those parts of regional New South Wales that are now open. So the only bit of information that is missing from that PHO is the issues around vaccination and mandate who's going to be allowed into venues and not. So in answer to those questions, Service New South Wales will be publishing a range of guidelines and answering a lot of these questions on Sunday. So we are going to be, well, I'm going to be staying tuned to this information on Sunday so that we can make sure that it's communicated across the sector when everyone gets back to work on Tuesday. So do stay tuned for any media around that, but we're assured that that will be coming out on Sunday, the 3rd of October. So all your questions about vaccination status, what vaccinations are in play, how you manage those things. We anticipate those will be answered on Sunday. The other main question we're getting asked is about December, and particularly around the 1 person per 2 square metres rule for entertainment facilities. And we're assured that the percentages of your 75% that you're currently allowed, or that you will be allowed on the 11th of October, won't be decreasing at that time. And we're waiting on an update for the agencies that are working on that roadmap to sort of qualify what the percentage will be. But we are given to understand that it will not decrease, and it should be, you know, increasing in line with the 1 per 2 square metres. The next questions, we're getting lots of questions about children, both unvaccinated and vaccinated. So we are advised that children will only need to be accompanied by a vaccinated adult in the context of hospitality, entertainment venues, major recreation venues, and places of worship. This means that for all other contexts, they will not be required to be accompanied by adults. And the second question is for children and the activities that they can undertake at this time. And we're advised that unaccompanied children will be able to undertake classes in art and culture, and subject to the limitations, I guess specifically around those 20 people can be involved in a sort of dance or physical exercise class in the current PHO. So those are the questions that we have. And Andrew, I'm going to answer that question about vaccinated adults, and just take you through what the reality of that is in place. So we have had a lot of questions about what constitutes a vaccinated adult, but I would just advise you to think about how adults have been checking in with children from all across this time. An adult has had a phone, they check in, they add their dependent, and all we know is that in addition to getting a green tick for entry, they'll also be getting a green tick for their vaccination status. There is no way for you to check the relationship between the child and the adult in that context. There are many different forms of families out there. It's not as if we're all going to have the same name. So I would just use your the way that you've been checking people into spaces as you would normally. I don't think anything should. I don't know what the settings will be specifically in the public health order around children, but I would just advise you to follow that procedure that you've already been following with people checking in children. And I don't see that they can specifically, that you'll be able to even get the children's ID. They don't carry around ID with them. So it stands to reason that you're not actually going to have the facility to check what their relationship is with those people. So there's another question about 20-person limit. The 20-person limit is currently on gyms. So I would just use the 1 person per 4 square metres for all other, for dance and gym classes, and use the 1 per 4 for all other areas. You are not, in a public health order, it's very general. It tries not to be industry specific, and in that way, you really don't want to appear in the public, your industry doesn't want to appear in detail in the public health order, because if that is the case, it means you are being legislated and your activities are going to be limited. So in this regard, if you want the New South Wales Health to be looking at you and what you do around this, I would suggest that you don't really want that. You just want to be treated as other industries are treated. Okay, so we're going to go through the 3 stages of the roadmap. So at stage 1, this is what we know. We know this, and we know what is in the current public health order, which I'll also go through. So Capacity limits. Hospitality venues can reopen subject to 1 person per 4 square metres inside and 1 person per 2 square metres outside, with standing while drinking permitted outside. Gyms and indoor recreation facilities can open under the 1 person per 4 square metre rule and can offer classes for up to 20 people, and this includes dance. Indoor entertainment and information facilities, including cinemas, theatres, music halls, museums and galleries, can reopen with 1 person per 4 square metres or 75% fixed seated capacity. In public spaces, people can have up to 20 people gathering. In mask wearing, masks will remain mandatory for all indoor public venues. Only hospitality staff will be required to wear a mask when outdoors. Children aged under 12 will not need to wear a mask indoors. And on social distancing, 1 person per 4 square metres or capacity limits apply. So there have been a lot of questions about whether you choose the greater of 75 or the 1 person per 4 square metres. The wording is equal to, so you have to make that decision. However, I will, when we come to 80%, it is the greater of, and is likely to only be about a week between 70% being active and then 80% being active. So I would suggest, if you're looking at those conditions, look at your timing. Do you actually have a show that's going on at the 11th of October or not? So you will be able to choose the greater of from 80%. Okay, I think next slide. So at stage 2, 80% double dose vaccination. We don't have the PHO to refer to yet. So we will understand what the detail around this is when that is released. So this is the information that we have. Capacity limit. So hospitality venues can reopen the same, 1 person per 4 square metres inside, 1 person per 2 square metres outside, with standing while drinking permitted. Gyms and indoor recreation facilities can open under the 1 person per 4 square metre rule and can offer passes for up to 20 people. Indoor entertainment and information facilities, including cinemas, theatres, music halls, can reopen with 1 person per 4 square metres or 75% fixed seated capacity, whichever is the larger. Information and education facilities, including libraries, galleries and museums, can operate with 1 person per 4 square metres. Public spaces can have up to 20 people gather, up to 200 people can attend COVID-safe events, up to 500 people can attend controlled ticketed and seated events outdoors. Stage 2. So we don't have the PHO. In mask wearing will remain mandatory for all indoor public venues. Only hospitality staff will be required to wear a mask when outdoors. So yes, masks mean staff, patrons, anyone that comes in. Children aged under 12 will not need to wear a mask indoors. So mask wearing will remain mandatory for all indoor public venues. So that's everyone. Only hospitality staff. Oh, sorry, we're covering the same ground. Apologies. I'm on autopilot this morning. Okay, so travel, unrestricted trips between Greater Sydney and regional New South Wales will be permitted at this point. Okay, next. So stage 3, the crystal balling. We've been asked a lot of questions about December, and a lot of them we do not know. So this is what we know. So density will shift in general to 1 person per 2 square metres for indoor settings. And I've already covered off the fact that we are getting advice on what the ticketed seated capacity will be for theatres, concert halls, anywhere with fixed seating. A COVID-safe plan will be required for outdoor events with more than 1,000 people. Hospitality venues can operate at 1 person per 2 square metres inside and outside. No seating required for eating or drinking. Gyms and indoor recreation facilities can operate with 1 person per 2 square metres uncapped. So that would be for your class of 2. So just remember that in these few weeks, we have a few different settings in place, but they really will only be in place for a few weeks until we reach the 1st of December. Entertainment facilities, including cinemas, theatres, music halls, can operate with 1 person per 2 square metres. And again, I'm getting the advice on ticketed and seated. Museums, libraries and galleries can operate at 1 person per 2 square metres. We don't yet know what case will be for the use of QR codes or anything else at this point. Mask wearing will be mandatory while travelling on public transport, planes and airports, and for front of house hospitality work. So that may include front of house hospitality workers within the context of theatres and cinemas. Masks are not required when outdoors, but that's all we know at the moment. Travel is unrestricted between Greater Sydney and New South Wales. Quarantine settings remain vaccinated arrivals, but they will be altered, and a cap on unvaccinated travellers might remain. So we don't yet know too much about those settings. Okay, so let's go through the public health order, where most of the questions, I believe, in the chat will be answered. Okay, so I'm going to share my screen at this point. So these are and if you have any trouble accessing public health orders currently, do send us an email, or I might ask Ashley to put in the chat where you can find all the public health orders. But for this part of the session, I am going to share my screen, and I've highlighted the parts that pertain to when we come out of this current lockdown. However, we do not have the vaccination status yet in this information. Okay, so share it now. Okay, so the public health order that we're looking at is COVID-19 additional restrictions for Delta outbreak order number 2, 2021. And the part that is pertinent to our discussion is, oh, I haven't selected it yet. Share, sorry everyone. Okay, hopefully you can see this now. Public health, COVID-19. Oh no, can you see it, Ash?
Yes, your screen share back.
Sorry.
It's just lagging, sorry everyone, sorry.
Okay, all right. So the order that we're looking at is Public Health COVID-19 additional restrictions for Delta outbreak order number 2, 2021, part 2, directions applying to general area. So this is what we anticipate will comprise the larger part of the public health order once we emerge from lockdown. Okay, closure of premises. So the premises that must not be open, so you can, if you're a premises that is not an amusement centre, nightclub, sex service or strip club, you can be open. The maximum number of persons permitted on premises, generally. So if you don't see your specific premises listed, this is what you need to be looking at. An occupier of premises in the general area must not allow more persons on the premises than the number of persons equal to, for the part of the premises that are indoor areas, 1 person per 4 square metres of space, and for the parts of the premises that are outdoor areas, 1 person per 2 square metres of space. So then there's a whole range of issues around this, and dance classes are listed here. So that is where your dance classes come under your 20-person limit. So if you're not a dance class, you don't have to abide by that limit. Okay, I will scoot past the things that are holiday homes, if you don't mind, and places of residence. So we come now to the maximum persons at entertainment facilities or recreation facilities. Okay, so The maximum person. The occupier of premises in the general area that is an entertainment facility must not allow more persons on the premises than the number of persons equal to 75% of the fixed seating capacity of the premises, or 1 person per 4 square metres of space in the premises. So this is for, 11th of October, likely to be a week or so before we get to 80%, and that will then become the greater of. And the occupier of a premises in general that is a recreation facility major must not allow more persons on the premises than the number of persons equal to the lesser of the following: 1 person per 4 square metres of space in the premises, or 5,000 persons. So, subclause 1A, so 75% of the fixed seating capacity of the premises must be relied on by an occupier only at times when admission to the premises is by way of a ticket, and that all persons on the premises, other than persons engaged in work, are assigned to specific seats. So there's no more information about how you assign those seats. That's up to you to do in your COVID safe plan. Okay, so again, maximum number of persons at classes at gyms and recreation facilities. So as we've already discussed, this also relates to dance, which is up above. So I won't go through the rest of this until we get to outdoor events. So the maximum number of persons permitted at the following outdoor events are as follows. For a controlled outdoor public gathering, 500 persons. So that would be your controlled outdoor events guideline. For a COVID safe outdoor public gathering, 50 persons. And for any other type of gathering in which you don't have a COVID safe plan, you've got 20 people. And so the conditions around controlled outdoor events provide for basically a restriction like a fence around the event, and for you to have a ticket to get into the event. Okay, so now we come to mask wearing. So this is where we also get enormous amounts of questions around who has to wear a mask. So I will not go through stuff to do with aviation, but let's just go through this. So a person in the general area who is over the age of 12 years must wear a fitted face covering while the person is in an indoor area of a premises other than a place of residence. And if the person has been in a stay-at-home area or area of concern during the previous 14 days, which most of us will have been. You must wear a mask if you're working at a hospitality venue and dealing directly with members of the public. And really, in an indoor area, you've got to wear masks, no matter who you are, except for when you're on stage. Okay. So I might just go through exceptions for certain persons. So obviously there are exceptions for people with disability, and you need to provide evidence for that. So I imagine that is a doctor's certificate. And there are other exceptions, and this is where we get the most questions. So you may remove a fitted face covering. So if you're a child under 12, obviously you don't have to wear a face mask. So hopefully we cover off all the questions about wearing face masks by children in dance classes through this. So if you're involved in a dance class and you're a child under 12, you don't have to wear a mask. However, if you are part of a gym or dance class, at the moment, at 70% vaccination, you'll have to wear a mask for that. But otherwise, if you're engaging in other kinds of physical exercise, you don't have to wear a mask. And you can be exempt from wearing a mask if you're engaging in work in which enunciation or visibility of the person's mouth is essential. And so obviously, if you are on stage doing a play or performing in any way, you can use this clause. Okay. So miscellaneous is where we get a lot of other questions hopefully answered. Singing or dancing indoors. The occupier of premises in the general area must not allow a person to sing or dance in part of the premises that is an indoor area. The clause does not apply to an educational establishment, a performer who is performing or rehearsing, a person who is engaged in instruction in singing or dancing. So, and it also doesn't apply to indoor dance activity. So hopefully that covers off all the questions in relation to singing. There are no other limits around singing at the moment. So you don't want to be providing for additional information in a public health order when there are no limits at the moment. So you don't want to be asking for distances. You don't want to be asking for the 5 meters or the 20. This is it. This is all that is regulated at the moment. So my appeal to you is that you don't want to be asking for more detail. So the other issue is that if you're at an event, people must be seated when they're drinking alcohol at this point. Okay, so I think I've finished with this area now, and happy to take questions on that haven't been answered. But yeah, so my appeal is if you're not part of the rules, don't ask to be part of the rules. Okay, so I'm going to try and not share my screen anymore, and I don't know how to do that.
It should say
Here
stop sharing.
Sorry. Okay. So I'm happy to take questions now.
I'm just checking for questions that weren't really answered. I've answered some in the chat as you were speaking, Beck. I know there was a question from Louise. Is there any coordination being discussed about touring shows crossing borders from the time of these New South Wales stages? And I'm assuming that will depend on the other states' borders there, whether they allow people from New South Wales, what that will change. That's up to each state. So you just need to keep an eye on that, and we can always help you find out what the restrictions are on crossing borders as each stage rolls out and where your shows need to go or where you're thinking of going.
Yeah.
Sorry, I've answered quite a few.
Oh my God, there's
just confirming back about what's included in the calculation of space, does it include the rehearsal rooms out the back, publicly accessible space?
So basically, your publicly accessible space, as with last year, does not include back of house. So and really the public health orders are for people going to venues, not people working in venues in general. So what you have to do in terms of your rehearsals should be guided by the other provisions within the public health order. So if indoor venues, like going into an indoor venue currently, any indoor venue is going to be guided by 1 person per 4 square metres. That's your rule.
Mark has asked, what is meant by a controlled event?
Yeah, I think I answered this.
You did answer
Controlled outdoor events are basically, there should be guidelines for controlled outdoor events, and they provide for outdoor events that are entered by way of a ticket and that have a fence around them. So basically not, a party in a park.
There's been a lot. Just been asked to clarify something you said, Beck. Under 12s don't wear masks.
Under 12s don't wear masks. Under 12s
Yeah.
don't wear masks.
That's it.
Yeah. They don't have to. They could if they wanted to. I mean, I'm all for encouraging mask wearing by everyone, but it's not mandated that they have to wear masks.
Yes. If we are not having any live performances during stage 1, but have the box office open to sell tickets, will staff and patrons be required to be double vaccinated? Yes.
I think anyone going into an indoor venue at this stage needs to be double vaccinated. This is what we understand.
Yeah, I've said that in another answer as well, but just to reiterate, the fact sheet that was released and all this information says that for stage 1, freedoms are for fully vaccinated adults. So we are just operating under, to do these things, the adults have to be fully vaccinated.
Yeah.
David, can a church be regarded as an entertainment venue for the sake of a concert?
I would say no at this point. So basically what the public health order does is it tries to cover off as many venues as possible in the one order. However, if you are doing a performance in a church and you want a greater capacity, you can go for an exemption. However, I would suggest that if you're going for an exemption in the October, in these periods where we're really just emerging out of lockdown, you're not as likely to be successful with that. So you always have the option of going for an exemption. So this is why exemptions exist, because we understand that you're not going to be covered off. Not everybody is going to be covered off by a broad brushstroke public health order, and the health order has to be as broad as possible to account for as broad a number of people.
Just reiterating, people are required to sit when eating and drinking in these stages. It's not until the later stages that changes.
Yeah. So if you're drinking, I think you need to be seated. I didn't see anything about eating, to be honest, in that.
No, but when it changes, it then says standing while eating and drinking is allowed.
Okay.
So. John has asked, can we refuse entry to people without a mask, even if they have an exemption on the grounds of private property?
I think this is an interesting question. I believe that, I've been using when you're inside a pub, they produce a whole range of rules around what you can wear and what you can do. And so my understanding of that law is that as long as you are not discriminating against people, so you may be, if you refuse someone on the basis of their not being able to wear a mask because of a disability, that you are actually discriminating against them. So I would suggest that you have a look at that in terms of your risk management and develop protocols around it. So if somebody is getting a mask exemption because of disability or mental illness, which is classed as disability, and you refuse them, then you might be in breach of another part of discrimination law. That's my understanding of it.
Just reiterating, there's a question, you have covered it, but we'll just say it again. Is there any distancing required for musicians, either in a concert or orchestra pit, i.e. woodwind, etc.? There's no restrictions at the moment. Like we said, you don't want
restrictions. You don't want to be mentioned. You don't want to be mentioned in the public health order, because those orders are there to limit activity. So if it's not mentioned, hooray for you, you can do your thing.
Social dancing allowed at an indoor event when we reach stage 3. Like we've mentioned, what we've shown for stage 3 is all that's publicly available at the moment. More detail will come out close to that stage. So we need to get through stages 1 and 2 first. Think of them as your guinea pig stages.
Yeah, so yeah. Yep. Carry on, sorry.
David, sorry to ask again, at what stage can children sing without masks indoors? Is there a limit on the numbers?
I think the question is, do they need to? Okay, let's have a look. It depends about the setting. So children should be able to sing indoors if they're in instruction in singing, and if they're and they don't have to wear masks under 12. So I would suggest that you're not prohibited. Am I understanding the question correctly, Ashley?
Yeah, I think, and that's how I read it as well.
Yeah.
So.
Yeah.
Okay, sorry, I've obviously missed some because people are saying sorry to ask again. Hayley, just to confirm, there are no limits to the numbers of performers performing on stage. That is, on stage, you do not need to adhere to 1 person per 4 squared metre.
No, I think when we went through that originally, it very clearly states that it doesn't include workers. So anyone on stage performing is a worker. So I would class your people in 2 types: people that come into your venue as audience or visitors, and people who are doing work in your venue. So the public health order and the distancing and all of that stuff relates to the people coming into your venue.
Sorry to ask again, are staff required to be double vaccinated in stage 1?
We understand that they do.
Yes. Beck, I think you mentioned that the proof of the medical exemption.
Yeah.
So just asking, what mechanisms are there for a venue to be able to assess the viability of a claimed condition or an exemption? So proof of a medical condition.
There's a form basically on I'm just going to find it for you because I believe this will be the form that is used. And it's called a contraindication form, and I'm going to share it with you when I find it. And this is there are lots of questions coming up about what vaccines are going to be acknowledged. So for the most part, you won't have to deal with that on a case-by-case basis because the Act should deal with that for you. I think it'll be in these cases of where people have exemptions and where people have different vaccines. So we're trying to get advice around the different vaccines that are available internationally and how they are going to be recognised within the app or at all, or whether people have to go and get the vaccinations that are approved by the TGA. So I'm just going to open up this for you. This is the current tool that is used for showing that you cannot get a vaccine. And this is what people have been using to take onto building sites or in other sorts of contexts as workers. So it's also available online. I'll just copy and paste the link so that I can send it to you. But this is likely to be the form that people will show you as evidence of their inability to take a vaccine. So hopefully you can all see that, and I will, I've copied the link. Okay, I'm going to stop sharing. Okay. So I'm just putting that link in the chat now.
Thanks, Beck.
Okay.
Yeah, I'll go back to the presentation.
And does anyone, just before we go back, does anyone have a burning question that hasn't been answered? Good-o. All right, let's Mirabelle's asking about unvaccinated people. So Mirabelle, I think in these early stages, they won't be able to rehearse or be employed at this time, is my understanding. So we can get some further advice on that, but that's what we understand at the moment.
Brett, like we said earlier, all PHOs are released the night before they come into effect. So there might be more details about the settings for December 1. Hopefully will be released closer to that date, but right now what we have is all that's available. But of course, as we get more details, we will send it out. But generally, the rule is PHOs are released the night before they come into effect.
Yeah. Okay. So it's because it's emergency legislation. That's the way emergency legislation is passed. It has to happen at the sort of, you know, so that you actually know the exact context in which you're moving into, not weeks before the event. So we've got a few more burning questions.
Yep. Is there any clarification? Sorry, it's moving very quickly.
Ooh.
Any clarification available from Create New South Wales around Jobs Saver scheme ending, or any further support available?
So we did hear yesterday from the Treasurer that JobSaver is being extended. So I think this is because I was fairly worried at this, you know, the announcement that would end and that people wouldn't be able to actually start on the 11th. So there is an extension to that which has been announced by a Treasurer. So there will be a media release on that. If you want to email us, we can send you that media release.
What about for singing rehearsals? Do we need to restrict numbers to the 4 square metre rule?
So yes, anything indoors under these settings, 1 per 4 square metres is your rule. That's the rule that's the only rule in play, really. Yeah.
Yeah. So I've had a couple of questions.
And Mark, you don't need to speak.
Sorry. Amanda, do workers from LGAs of concern still have to abide by the current restrictions until December the 1st?
No, all those will go away. We've been hearing on the press conferences that we'll be back to everybody is the
same. We will share a link. We'll send out the fact sheet, which has the stage 1, 2, and 3, or 70, 80, December 1st summary. We can send that out with the recording of this webinar when it's ready. That's fine. Okay. Mark, in case a LGA suburb or area is locked down again, will authorised worker arrangements and travel permits be put into place? So,
so if an area becomes locked down through this period?
If there's a snap lockdown again.
So we understand that we don't probably have all of the detail around that, but I'd suggest that what is in the current public health order will be retained when areas go into lockdown. So yes, probably would be the answer to that question. But and obviously arts and culture workers are not on that list, unfortunately, but I will say that we've had some success in the last 24 hours in getting some workers approved who are in arts and culture contexts. So if you do find yourself in that situation, then we will do whatever we can to help you.
So just Ian has very kindly reiterated what we announced in our housekeeping. If anyone who is not Beck and I could turn off their cameras, please. It just helps the quality. There's 150 of you on here, so it might just help with the delays. Thank you. Roxanne, age for children unvaccinated to attend or perform at a theatre in stage 1 and 2.
Well, unvaccinated children are allowed in venues. So I think that my sort of I would urge that you don't create extra rods for your back. Read the public health order. If there's nothing in the public health order that prevents you from doing what you are doing, then go ahead and write your COVID safe plan and do that work. So the main thing that we're looking at is the indoor areas are currently going to be governed by the 1 person per 4 square metre rule. We don't have further indication around how people can congregate, what people can do. But when you're on stage doing a performance, obviously, you know, you're a worker and you need to do the work that you're doing in that space. So you're not under the sort of same conditions as those venues are. But, you know, where possible, I would suggest everybody, the 1 per 4 square metres is the abiding principle. So just try to stick to that wherever you can. Obviously, on the stage, you're not able to do that.
Questions about will there be density limits or will there be other limitations at 80% and onwards? We don't know yet. So the public health order will come out and it may include it. As we've said, you don't want that to happen really, unless it's going to allow you to have more people. So we're not sure on specific percentages just yet, unless we've already mentioned them. Those we've covered. Louise is asking if there is a case discovered in a workplace or an audience of an indoor ticketed event or more than 1 performance, is it New South Wales Health that will dictate whether a show has to shut down and how long for?
Good question. We're going to cover this off. Well, we were going to cover this off a bit later, but we're sort of fast running out of time. So what we can do is we can send you a link to a risk matrix that has been produced by New South Wales Health. They are currently looking at how close contacts and casual contacts will be dealt with once we reach 70%. So at this time, obviously, if someone is a close contact, they have to isolate for 14 days. We're not exactly sure yet what that situation is. However, I'm going to quickly share with you, because I think this is really important information, and hopefully it will give people some assurance that if someone's in their audience and with COVID, that you're not going to have to close everything down. So I'm just going to share that now. We will have to, unfortunately, stop this meeting at 11 o'clock because we all have other things to go to. But I would hope to be able to send this information out to you today anyway. So I'm just going to share it. Okay, so this is a working document that's been produced by New South Wales Health. This hopefully will give you some good information that will help you to do your risk assessment in your venue. We're yet to hear sort of what level New South Wales Health are going to be conducting contact tracing. So I'm just going to take you to the tables because these will give you the most information that you need. Okay, so with contact risk assessment, the risk of COVID-19 transmission is increased when a person has a close range of less than 1.5 metres contact with a case during the case's infectious period, or shares an indoor space with a case during the case's infectious period. So these 2 risk categories are covered in the table to follow. So for people who have had close range contact with a case during the case's infectious period for both indoor and outdoor settings, this is basically how they're looking at how they're dealing with that risk. So if you have had partial or no vaccination and you've been in direct physical contact with someone, then you will be defined as close contact. if you are a fully vaccinated person, which should be all of your staff and all of the people coming into your venue, but a few cases that may not be, you will be defined as either a casual or low risk contact. So this is really important. So this information tells me that, Mirabelle, I'm going to send it to all of you guys. So don't worry, you'll get this. And it's online, hopefully, at the moment. And this is going to be updated as well. So in table 2, this is also about sort of time and space. So the amount of time that you spend in a venue and the kind of space that's in that venue. So for people who've shared an indoor space with a case during their infectious period who've not had close range, so for less than 100 metres squared, for less than a minute, everyone is going to be a low risk contact. But if you are not vaccinated, you start to enter these high risk areas. But basically, for everybody in a theatre space or a gallery space who's vaccinated, you'll be at low risk. And under these conditions, you will not have to get tested. You will simply be monitoring for symptoms. So if you're in an indoor space of less than 100 metres squared for over 15 minutes, you may be defined as a casual contact. But how that definition comes into play, we don't yet know. So we don't think that, as we've discovered over the last 14 weeks, we were getting very rapid sort of information about venues, cases of concern, as the transmission has expanded. Obviously, the capacity of health to undertake to inform people of these events has been reduced, has been limited. So my urging to you would be to make sure that you do what you can with the information that you have. So you are able to, if you're alerted by someone, a member of the audience, potentially, who calls you and says, I've just been identified as having COVID, what can you do in that regard? You can't contact your audiences through the QR code system because you won't have access to that. The only tools that you'll be able to advise people about is basically that, if they are unvaccinated, if you have ticket information from them, you might be able to call or send a broad email out to your subscribers to say that someone has informed us that they have had an infection at this time. So if you're vaccinated, you'll be low risk. If you're unvaccinated, you might be a higher risk. So we just urge you to monitor for symptoms or get checked. So in your Covered Safe plan, maybe that's the process that you outline that you'll do. You'll have more control over what you can tell your staff because they're there and you're in contact with them, you've got their emails. So I will be using this risk matrix to basically identify the kind of information you should be giving to your staff and putting that into your risk plan. So basically, close contacts, my understanding is that they're currently being redefined and the terms under which a close contact should proceed with that health advice, as well as casual contact. So we'll send you this information. You can use this material to support you to undertake risk assessment for yourselves within your own context. So questions on that?
Beck, can you please clarify this matrix is current only and may change on 1 December?
Oh yeah, it's a working document. So my understanding is this is going to be a working document that is accessible through this whole period, but would be subject to change if New South Wales Health make a determination, maybe at 80% that actually the risk matrix is wrong because they've discovered new information. They would change it. Or you might find, I mean, this is the useful thing, maybe the risk matrix will stay the same, but what will change is how close contacts are dealt with, is how casual contacts are dealt with. So those things will always be rapidly updated because they're not PDFs, they're websites. So we imagine that would be the part that would change the most.
And again, we'll send that out with the fact sheet and any other supporting materials when we send out the link to this recording. So don't panic, we'll get it to you.
Yep.
I think that was all the questions on the matrix spec. I've answered a few more questions. I was just going to say we've got 2 minutes left, so we might just quickly run through the rest of another slide on the PowerPoint. And if we haven't got to your question, if you feel like your question hasn't been answered through our discussions, the last slide will have our email addresses, and you can feel free to email them to us. I'll keep that slide up and we'll answer your questions.
I think I just want to answer this question from Mirabelle as well, about children being able to attend a performance without their parents. It really depends on the venue. So if the venue is an entertainment venue, then no. But if it's outside, if it's somewhere else, then yes. It's basically people are not able to attend particular venues as children unaccompanied, but other contexts, obviously they're going to school unaccompanied, and a whole range of other places they are able to attend.
Oh, sorry, Julie, I didn't see the first question you asked. Do we have to wait? So are people considered double vaxxed as soon as they get the second vaccination, or do they have to wait the 14 days, or once it pops up in their app? Do we know that?
I suggest as soon as they can get their certificate and identify that they've been double vaxxed, that is the status that you follow.
Yes. Okay. Becky, you happy for me to share? Okay. So just quickly, we've gone through the available guidelines, which are part of the current COVID safe plans. And I've pulled out the key points for information and education facilities, which include museums, galleries, and libraries, and also your entertainment facilities, which include theatres, concert halls, music halls, etc., cinemas as well. So these can change as COVID safe plan requirements change, but these are just good things for you to start thinking about when you'll have to go through it for your COVID safe plans. And it's just basically a reminder on the capacity that your type of facility can have, ensuring your physical distancing where possible, reviewing the COVID-19 guidance on ventilation and making sure that you're following the guidelines relevant to your premises. Mask wearing, hand sanitizer is available using the government QR code system. And if people can't use the QR code system, having a system in place to collect that information and getting it up to New South Wales Health as soon as possible. And it's very much the same for entertainment facilities. Obviously, it's just a different capacity. But if you go to the COVID Safe Plan website and you start to fill out a COVID Safe Plan, you will see all these guidelines. So it's just a handy tool. Beck's gone through the matrix, and we've already really covered that there are things that we are waiting to receive more clarification on, particularly 1 December onwards. And again, the PHO for 80% and 1 December and 70% won't be available until the night before, but we will always share that when we update, send you out our update emails.
And don't hesitate to get into contact with us if you've got any burning questions. But again, I would urge you to, if you're not mentioned in the public health order, it's probably a good thing. And if you're having any concerns with particular venues around whether you're able to do things, we're very happy to write support letters to you to clarify that what you are asking for is allowed under the public health order. So we're very happy to do things that will give your venues confidence if they're umming and ahhing about allowing you to do something. So we'd rather do that than you request change to the public health order, because you won't like what you get. And that's been the case basically through the last 12 months. So we feel like we'd much rather spend the time doing those letters than getting you a resolution that doesn't work.
Yeah. And that is it. So I'll just keep this up here for a second if you want to jot down our email addresses. But we're happy to chat, and thank you for joining. And we will send out the recording and all the supporting material as soon as it's available.
Thank you.
Thanks, everyone.